I'm Gary Bembridge, this is Tips for Travellers. I want to talk about why the US is so set against cruising resuming inside US waters anytime soon. Why is it that from a cruise lover's perspective, cruising seems an increasingly safe place to travel, but the authorities who make the decision don't? This is really all about the CDC, the Center for Disease Control and Prevention. They are the people who decide if cruising can start, and they are pretty hostile towards the cruising industry. And this was seen most recently in a 20-page document. There are 6 key reasons that this document actually highlights and draws attention to about why the CDC is so set against cruising. First of all, and probably the most significant of all, is the CDC strongly believes and keeps saying that they do see cruise ships as being a much higher risk than any other settings, any other land-based place for transmission of the virus. They see cruise ships as extremely high risk. Partly fueling this is the fact that 80% of the cruise ships that were within US waters between the beginning of March and the 10th of July had outbreaks on board the ship of COVID-19. That's 99 out of the 123 ships in US waters had an outbreak. And even at the time that they issued the no sail order, 9 ships still had some kind of COVID-19 issue on board. So basically the data, 80% of cruise ships having some incident of COVID-19 is reinforcing and driving their belief that cruise ships are a particularly risky environment. They quote a number of different scientific sources, including one which looked at the rate of spread, or the R rate, on the Diamond Princess, which was up to 4 times higher than many countries had on land. But they specifically say, and this is a quote, "The current scientific evidence suggests that cruise ships pose a greater risk of COVID-19 transmissions than other settings. Cruise ship conditions amplified an already highly transmissible disease." And what they talk about is the mere fact of the nature of cruise ships and the ecology on cruise ships. So you have a lot of people in a contained space. It's relatively difficult to do social distancing. The crew are sharing quite cramped quarters. They're sharing quarters. The facilities available just on board, because people are going to theatres, they're going to bars, they're going to nightclubs, they're mixing a lot. That is just an environment that enables the spread much easier and much quicker than it does in similar situations on land. People may disagree with this, but this is clearly a very strong belief that cruise ships are very high risk. And this is something that the industry is going to have to work on to get the CDC to shift from. They talk, for example, in the document that they've had to do contact tracing for over 11,000 passengers, which is significantly greater than they've had to do for COVID-19 outbreaks linked to any airlines and flights operating within the United States. They also argue that data they collected during the no sail order also show that even if you drastically reduce the amount of people on board, the virus can still spread. And they quoted, for example, some experiences on the Disney Wonder where they had a lot of outbreaks of COVID-19 even once passengers were off, which went on for many weeks. And they also talk about how 4 Royal Caribbean ships, which had no incidences captured during a 28 period, there was no testing. However, when crew disembarked, tests were done in the countries where the crew came from, and 55 cases were found, even though nothing had been picked up on board. And this is largely, I guess, because of asymptomatic people spreading the virus. The second reason that the CDC is against cruising resuming anytime soon is they specifically talk about in the document about the risk of getting people to go on and off cruise ships when basically the virus is not under control on land. So they talk about different states and different countries not yet having really got the infection rates truly under control, and in some cases really increasing. So getting people to come on and off cruise ships is just exacerbating and creating a significant problem. So they are against cruising starting up whilst on land infection rates are still high and growing. And they do specifically talk about the infection rates around the world. The third area, and this is one that certainly has come up many, many times, and I believe is a big issue, is the real concern that the CDC has around the amount of resources it's taking them to manage the whole situation that developed when the pandemic broke out and the first no sail order and repatriating passengers and crew, just the amount of time it takes. But also significantly, they talk many, many times in the document about their concern about the drain on federal, on state and on local resources and importantly facilities, including and especially talking about medical facilities, putting a whole big drain on the system by getting lots of either crew or passengers back on board. They talk, for example, since the beginning of March, they have expended over 38,000 man-hours in the CDC alone, and that's really been focused initially on the passenger situation as the no-sail orders started up, but also in terms of repatriating crew. Even though they actually resisted a lot of crew actually disembarking in the US and had rules where ships had to basically sell them home. They also then spoke about the fact that despite those restrictions, they had to supervise and were involved in the repatriation of getting 8,800 odd crew off the ship, making the point that only 314 of those were US citizens. They are extremely concerned about the drain that if they let cruising start up again and there's any issues that it will put on resources at federal level, local level, state level, and especially, as I mentioned, around the strain it could put on the medical resources and capability, particularly, I guess, when things are happening on land where those resources are already pretty stretched. The fourth area is also one that they talk about a lot. They spend a lot of time in the document talking about this, and this is about how they feel that overall cruise lines are actually pretty unreliable and haven't really been very good at following the rules. They have two sections in the document which are especially telling, and they have a lot of detail. And these are, first of all, one section which is called Difficulty of Cruise Ship Operators in Submitting Appropriate Response Plans. And secondly, they have a whole other section which is entitled Examples of Potential Non-Compliance with the Extended No-Sail Order. As you can see from those two sectors, they have a lot of reservations about the ability of cruise lines to actually be a partner in this whole process. So they talk about how cruise lines didn't really respond particularly well around the whole area of crew repatriation and the rules that they're required to be put in place. And then they had lots of evidence that they were not being complied to. They spoke about how the plans that were submitted were incomplete, that keep going through reworks to get them into a good situation. They also point out that they have a system, a green, amber and red system, and there is only one cruise line so far that they have signed off that's following all the protocols that they're happy with. And that's actually not one of the main cruise lines. That's the actual Bahama Paradise line, which is a relatively small line that many people probably won't even heard of. They then also talk a lot about how even through the crew process, they had lots of evidence of non-compliance. A lot of that was picked up either on social media with stuff that was being posted or through some sort of whistleblowing, like people from ships sending it in. And they specifically talk about their concerns around, even though the rules were around social distancing, they had lots of evidence that this wasn't being enforced on board. There's lots of pictures of crew partying, gyms being open, salons being open, communal dining, self-service. And also one of the things that wasn't allowed is non-approved movement of crew between ships, and reports that they believed that ships were heading out of US waters and doing what they called unapproved or illegal kind of crew transfers. So lots of concerns that they have around the way that cruise lines develop plans, submitted plans and comply to them. Now, I'm pretty sure the cruise lines would challenge that. However, we're talking about what the CDC thinks here. So clearly they have reservations when it comes to them dealing with crew. And this, of course, means that they have concerns when it comes to thinking about what they're going to do when it comes to passengers. So certainly a lot of kind of reservations and in some way potential mistrust of the cruise lines. And that again seems like a big hurdle to be overcome before they're going to be happy to sign off things moving ahead. The fifth point was something that actually surprised me, because I had certainly believed from what I'd seen and read about was that Clear and the cruise lines were kind of quite a united front in their discussions with the CDC. However, this doesn't appear to be the case, certainly from the CDC's perspective. And they do talk about two things. They talk about a need for a really coordinated response from the industry, and also much more detailed and thorough plans to address their concerns, which are slightly different to what they believe cruise lines are currently communicating, certainly out to consumers. So let's explore that a little bit more. They have a section which, again, its title is probably pretty telling in itself. And this particular section of the report is called Lack of Consensus Among Cruise Ship Operators and Need for Additional Industry-Led Efforts Regarding Safely Resuming Passenger Operations. So that's quite a long mouthful, but what they really talk about in here is very interesting. First of all, they talk about they want an industry-led and coordinated response. They actually specifically call out the joint alliance between Royal Caribbean Group and Norwegian Cruise Line Group, which have formed the Healthy Sailing panel, which has some pretty big leading ex-government officials in there, ex-members of the CDC, the FDA, and lots of different health authorities. They talk about it's great that this has been formed. However, they very pointedly talk, and in fact they have it in italics, the fact that this group is only going to be reporting back within the coming months, i.e. the sense that they are making, I think, a little bit of a nudge or pointing out the fact that the industry still hasn't developed a consensus around what the right protocol is going to be. And secondly, they then also in a very pointed way talk about how cruise lines appear to be issuing stuff through online and in print marketing materials which cover a whole range of different things they're doing, but they're sort of making the point that this feels more like a PR exercise than big substantive plans which they've had input and discussed. So they do obviously allude to some of the things that they've seen cruise lines talking about, like reduced capacity, different protocols, cleansing protocols on board, that kind of stuff. But they do actually make the point, and they specifically say in their document that it would be of benefit to have further industry-led engagement. So clearly there's still a sense that they're missing something big and coordinated from the cruise lines themselves. What they talk about in this document, though, is a bunch of things which they have a high degree of concerns about, which are perhaps not the sort of things that we have sort of seen so far coming out from cruise lines, although I'm sure cruise lines are addressing them. But they talk about the sort of things they want to see in plans are things around, they want to know about testing capability, either on board or the ability to do it very fast turnaround, and actually much more extensive testing, for example, particularly amongst crew. They talk about medical facilities, making sure that cruise ships are able to isolate and manage any issues on board in terms of quarantining or dealing with passengers on board the ship, not having to rely on land-based or shore-based activities. Then they also talk about if there is an outbreak on board, they want to see a plan which minimizes or completely eliminates the need for onshore, i.e. US resources. They talk about perhaps deploying a ship to handle quarantine cases, a ship which perhaps acts as a hospital ship, and perhaps even another ship which handles care for once people have got over the virus. So they're really looking for a plan which minimizes the use of onshore and US-based resources. They do also ask if there is an onshore element, how this is going to be done in a way that, again, minimizes the impact on local land-based US resources. The next area that they talk about is they also clearly state that they do not see themselves as an outlier. They do talk about many other countries around the world have a similar approach and belief on cruising. So though we have seen some ocean cruising starting up for local people like Germans can go cruising around Germany, French can go cruising around France, the Norwegians, Scandinavians can go cruising around Norway. They do talk and argue that most countries around the world, or certainly many countries around the world, have a similar approach and belief around stopping cruising really rolling out, certainly across countries. They draw attention to Canada closing its ports, Australia closing its ports, Spain closing its port, many countries in the Caribbean or islands in the Caribbean not welcoming cruise ships and closing to cruise ships. So basically they refer to lots of countries around the world having a very strict no-sail approach to cruising. The CDC is really fundamental in deciding if cruising can start in the US. So what I wanted to do is explore why the CDC is so against cruising, but pretty much they see cruising and cruise ships as a high-risk environment. Getting people on and off cruise ships increases that degree of risk when it's not in control on land, and also they're not comfortable that there are plans in place and that the lines would comply with all the plans even when they're in place. So quite a long way to go, it feels to me, before cruising can get going. But I really want to understand, why is it that from a cruise lover's perspective, cruising seems an increasingly safe place to travel, but the authorities who make the decision don't? Hopefully you found that interesting and helpful. I'd love to know what you think about this whole process too.